Hi, I'm Dr. Robin Miller for Health Day. Today we're going to talk bird flu, the increasing numbers, the newest mutation, whether it's a threat to humans, and could it cause another pandemic. So far, there have been 67 human cases in the US, all but three from contact with infected poultry, dairy cows, and other animals. No human to human transmission. Most cases have been mild, but a growing number of scientists say the virus could evolve and become dangerous. One expert who says we better pay attention is Dr. Peter Chin Hong, an infectious disease specialist at the University of California, San Francisco. Welcome, Dr. Chin Hong.
Thanks for having me on.
So, I'm going to start right in. Do you believe bird flu poses a public health threat or will in the near future, and why?
Yes, I think it poses a public health threat because the writing is on the wall. Um, we've had in the last, three or four pandemics, influenza mutations came from origins in birds, so we're seeing it again. The pace has really picked up in the last year or so, and even in the last few months, as more wild birds get infected, as more poultry and dairy cows get infected, and ultimately incidental infections to humans. So we have a lot of influenza going around, and influenza is engineered to really swap genes with each other, and they can pick up tricks. And some of those tricks include getting the combination to enter our bodies, which is not so great at doing right now.
So, for people who may not know what bird flu is, can you give us a short science lesson?
Yeah, so bird flu is also known as H5N1. That's the specific kind we're talking about today. It's a flu that's highly deadly to birds. This particular bird flu has been around for about 30 years and caused about 1,000 infections in humans globally, and about half of them have died. Fortunately, not as many people have died in the United States, mainly because it's very awkward right now. The virus is really trying hard to figure out a way to really enter our bodies as humans, but it's not really figured out that perfectly yet. So the reason why we're worried is that over time, as a virus makes copies of itself, just like in COVID, it's not really precise. So at some point, it's going to make the mistake of getting the right code to do more invasive disease. And it's already crossed over into about 50 mammals. So it's kind of started off in birds. Then people were incidentally infected around as well as animals. And now it's really crossed over into mammals more efficiently.
What are the symptoms of bird flu in humans?
So the symptoms of bird flu in humans are very similar to regular flu, except that right now it's milder in most people. So you'd get congestion, you might get a cough, red eyes is a very common symptom so far. You might get ear pain, but it's really obtained by milk splashing onto dairy workers or touching an infected surface and then touching your eyes. So those are still the most common ways in which people present. But all of this may change. And we know from regular human flu, as in the case in Louisiana and the case in British Columbia, when it becomes more efficient at entering our bodies, you might get inside disease, and that includes shortness of breath, and you may have other organ involvement.
Dr. Chin Hong, do you think that the current number of bird flu cases is underestimated because people don't realize they have it?
Yes, I think that the number of cases is underestimated, mainly because we're doing passive surveillance in many parts of the country, meaning people have to come forward and say, I handle a sick bird, or I'm a poultry worker and I have pink eye. And many people in the community, there have been several cases already where there was no known risk factor, like two children in the Bay Area. So I think all of these can't get detected in our current mechanisms. There are some surveillance, you know, projects afoot where people just look for regular human flu and try to pick up those that might be bird flu and then do additional testing. But those have not been sort of organized in a national level. There are efforts to do that, but only in some areas, like in some parts of California, for example.
How can we reduce our risk for getting bird flu?
The first and most important thing is to get immunized against regular human flu. And the reason why we want to do that is because it lowers the chances if people get infected with more than one flu type, including bird flu, it lowers the chance that such a gene swap will occur. And human flu is already engineered to enter our bodies well. If you have bird flu and human flu swapping genes, you can make almost like a Frankenstein bird flu. The second thing you can do is, of course, not handle dead birds. Um, Take care of your pets, particularly cats, I would say, and not feeding them raw milk or raw meat. Not drinking raw milk or unpasteurized dairy products yourself, as the risk increases in dairy cows. And as we've learned from the case in Louisiana, handling or interacting with your own backyard flocks or chickens might be dangerous, particularly if they look really sick. And that's because, the infection is really a pandemic in birds right now, and these birds are flying all over.
Dr. Chin Hong, what are the treatments for bird flu?
Yeah, so we have 4 active influenza drugs right now for regular human flu. At least 3 of them will work very well against bird flu, including oseltamivir or Tamiflu, which has been used in infected people so far and seems to be well tolerated, just like they are in normal. I think if it evolves, we may have to think about different strategies like we've done with COVID therapy. But right now, at least we have something on the block. We also may need to stockpile more Tamiflu if needed.
What about eating eggs and chicken, that sort of thing?
Yeah, so right now, eating eggs, chicken is generally safe. When birds get infected, even poultry and chickens, they get infected very, very quickly. And and to treat that, owners typically cull all of these birds. So it's very, very fast. It's very unusual or very unlikely for an infected poultry chicken to pass on infected eggs and for us to actually consume that chicken. The other aspect that really lowers the risk is, of course, cooking our meat well, which we'd want to do anyway to prevent other kinds of foodborne diseases like Salmonella and Shigella.
Is the virus mutating faster than expected?
Well, I think the length of the road before mutation that allows easier entry into our lungs is much shorter than people think. And there's a study in San Diego and La Jolla where they, looked at the amount of mutations needed before that can occur. And it was very, very short, just one mutation. Doesn't mean that this mutation will pick up, but what it means to me is that it's not that far away. We also know that from the case of H5N9 in Merced County that these genes of regular bird flu that we're talking about, H5N1, and another flu can swap genes. So again, these are not theoretical concepts. They're real. And we know that the virus can also mutate once it's infected someone. That's likely what happened in Louisiana and what happened in British Columbia. So, right now it's low risk to the general population, but it's not far away. And the way I think about it again is, the train has already left the station essentially, but we can control the speed of the train and put up buffers to make it impact much more softly than otherwise. And the speed of the train before it falls over the cliff is also related to the probability of getting these mutations.
How can we get the word out with the silence imposed on the CDC and other government health agencies?
I think, it reminds me of the early days of COVID. People really stand up and disseminate information themselves. We've learned that in the recent case of the ducks being infected with H5N9, which is not the same, but a related bird flu, that information came from an organization that wasn't federal. So you can still get it in different places. I think it's not perfect. Some states have really well-oiled machines for communication like California, but no agency can act in a silo, so we can't probably do well if this continues for very long. With
The
more
hi-
voices giving information, I think there's a higher chance of misinformation. So that's what I'm worried about.
yeah. The H5N9 you mentioned, is it more deadly than the
No,
H?
the H5N9 is not more deadly to humans because it hasn't really figured out that right combination code to, again, enter the receptors in the lungs. Um, but again, it's just a warning sign. It's just a canary in the coal mine. It's something that makes us pay attention with an exclamation point.
Yeah. So is there a concern that bird flu is going to become airborne like COVID-19?
Well, there's certainly a possibility that it can pick up mutations that will allow it to be transmitted uh, through the air, which is much more likely to infect more people than droplets, which fall much more quickly. So it's not out of the question, just like it has done in other kinds of respiratory viruses. But flu is generally not COVID or coronaviruses. So I'm hopeful that it will stay, just in the ways that we think about human flu, which is mainly through droplets and contacts and not through far distances like dandelions.
Yeah. If human to human transmission started, would the N95 masks protect us?
Yes, I mean, I think that an N95 mask will be very protective against flu, but ultimately, the solution, like in many pandemics and outbreaks, is vaccination. So it's going to be much more effective than a mask in the long term. But again, for short-term intervention, washing hands appropriately with soap and water for 20 seconds, N95 mask would be very important, as well as ventilation, of course.
So the US has a stockpile of 4.5 million H5N1 vaccines. And although they're based on old mutation formulas, do you think they would work?
Yes, I think that the stockpile vaccines would mitigate the effects, probably by preventing serious disease, hospitalization, and death, although the code isn't exactly what the current state of the mutations in bird flu are. It's a good start, and it will be a good way to protect probably frontline workers in the event that we need to, roll that out more immediately.
Other countries like Finland have started vaccinating farm workers. What would be the pluses and minuses of doing that here?
I think vaccinating farm workers, particularly for those who request it, is not a bad idea. I think the pros is that it gives people more agency in protecting themselves because there's so many reasons why people don't come forward. Some of the cons include probably not protecting populations because only some people get vaccinated, some others. So you probably have to think about other interventions. Another con, of course, is that it's not the most up-to-date code per se. So if the virus did mutate, you'd probably want the more recent combination, so to speak, of genes on the surface of the virus. So, I think, and then of course there the whole barriers of cost and how you distribute it, how you prioritize different groups, because 4.5 million vaccines might put a dent in some of the dairy and poultry workers, but it won't go very far in the population. Probably about 2% of the population, because you would probably need 2 shots in the beginning of a new vaccine.
Pharma companies are prepping for a potential bird flu outbreak. Are you concerned about the administration, specifically Robert F. Kennedy Jr.'s anti-vaccine stance?
I'm concerned about, any barriers at the FDA level, at the level of federal agencies, in terms of not only the science, i.e., cutting and pasting that code, particularly if you use an mRNA vaccine, but also the implementation of the science. So implementation means, you have an emergency use authorization before it's fully approved, or you have lower barriers to get it through the FDA to that point, and you distribute it equitably to all populations. So I think on multiple levels, I'm worried. I know that humans are resourceful and we'll come up with the science, but the devil is always in the details, and implementing the science is often even more important than the science itself.
I totally agree. Many researchers believe that insufficient federal actions have been taken to manage bird flu thus far. So, what do you think we need to do now?
Well, I think we need to get an idea of what the spectrum of disease is and what the scope of disease is. Right now, we're just getting, some states with bulk milk testing. We're getting incidental human reports, but we don't have an idea of the denominator. We have an idea of the numerator, so the number of people are infected, but we don't really understand or have an idea of risk. And that requires doing a broad population-based screening. I think that there are efforts with vaccination in terms of having a stockpile and being poised to change the formula if there's a mutation to allow the virus to spread from human to human or cause more serious disease. And then, of course, but there's still a lot of room to go. One of the areas that I think we need to focus a lot on is testing, because like with COVID, if you don't test, you don't know you have it, and therefore you can't protect yourself from others. So not only testing that's bottlenecked at a state level or a federal level through confirmatory testing, but rapid and nimble testing requiring things that people can use at home, which is probably going to be the ultimate benefit, and something that's low cost or free so that everyone can use it. So, again, there are many pluses, but there are also a lot of things that we have to do. At the end of the day, having a national strategy and alignment between all stakeholders is going to be really important if we're going to have much community buy-in and benefit.
So, is there anything else you'd like to add?
I think that I'd say, again, not to panic about this right now. We're in a very different place from the early days of COVID because we have a test, we have vaccines. This has been around for 30 years. We have 4 drugs. But again, connecting the dots is always going to be key, and working together in a bipartisan way.
Thank you so much, Dr. Chin Hong.
You're welcome, Robin. Thank you.
Information's invaluable.
Thank you.